So the recent healthcare reform bill that was passed last year obviously didn't include immigrants into the exchange, and that was something that a lot of our groups were lobbying for. There's a great number of immigrants that are in need of health care. We've seen that here in the county clinics and the student-run clinics. We've seen an increase in patients coming to our clinics. And I think the next step that we should take is hopefully lobbying for immigration reform.
And there's no one to provide health care for undocumented immigrants. This is a very big problem. And we have to look at how are we as a group going to affect change.
Especially like in the small community of Knights Landing, where they have lost all of their healthcare services. They've lost a lot of their schools. They've lost a lot of resources. So what we're trying to do as first-year students is we're trying to open up a student-run clinic that provides services for the people that reside in that community, which mainly include Latinos, agricultural workers, and a lot of the elderly and their children.
We as UC Davis medical students, we're in a unique position because we're located in the California State Capitol. So one of the advantages of that is we can take our projects to the legislature and help them understand that there's a high need for services for undocumented immigrants, so that hopefully healthcare reform in the future will be more reflective of our California population and the Latinos that are in need of healthcare services, not only in the emergency room, but to have a primary care physician, we feel is something really important to Latinos, because in our clinics, like Clinica Tepati, we service patients that have no primary care services, and we see how important it is to their quality of health.
In addition to that, I think that a big emphasis in education is also lacking in terms of legislature. I think that really contributing and the resources and allocating enough resources to education is so vital. There's so many rural school systems that get shut down, schools that get shut down. I remember growing up, I went to a migrant school, and it was K through 12, and a few years later it got shut down just because there's not enough resources in terms of not only money but teachers to go out there.
And so part of organizing us together as a group and looking towards the future, in my opinion, things that will help promote Latino success are things like funding for Latinos that want to enter medical school but don't have the money to pay for MCAT prep courses, and things like funding for Latinos who want to go into academia but don't have the resources to pay for a summer research project, or their parents can't afford to send them to do a 6-week summer research project.
It's a very hard task. I mean, we all at times feel very stretched thin. We're like jugglers. We juggle all of these different facets in our life. But it's also the key to keeping things motivated, because I think being able to serve in these clinics, being able to do all of these extracurricular activities kind of keep you grounded and remind you of the reasons you're here. You know, so for me, I wouldn't be able to stay in med school if I wasn't involved in these activities. You know, it's such a significant part of my life right now, and it's the reason that I'm still here.